So this screencast is just going to go over some of the basics of type 2 diabetes, what it is, how we work out whether people have type 2 diabetes, risk factors, that kind of thing. So what are we talking about? We are talking about a chronic long-term metabolic condition that is characterized by insulin resistance. So that means that the body is unable to effectively use insulin. You may also have insufficient insulin production from the pancreas. So that combination leads to blood glucose building up in the blood, and we have hyperglycemia. So of all types of diabetes, type 2 is the most common, and it's estimated that 9 out of 10 of the people living with diabetes have type 2. And these figures have gone up since last year. So in the UK, we've got more than 5 million people living with diabetes. And it's estimated that there's probably another 850,000 or so undiagnosed. There are also thought to be about 13.6 million people whose blood glucose levels are higher than you would hope and are in that what we call pre-diabetes category. So they may well go on to develop type 2 diabetes, and we're going to talk about that a bit later. I'm just leaving this link for you, and I would strongly encourage you to have a look at this. It's only a few minutes, less than 10 minutes, but it just explains the difference between normal metabolism and the metabolism in diabetes and what is happening. So that was a better way of explaining it than me going through it. So let's have a look at the risk factors for developing type 2 diabetes, and you can immediately see it's an extremely long list. The top ones really are people living with obesity, particularly those who have abdominal obesity, around their middles, around that with a high waist circumference, and that's because the fat is around the organs and can also be within the liver and the pancreas. So being overweight, living with obesity are risk factors. Majority of people with type 2 diabetes are living with obesity. People may have insulin resistance for a number of reasons, and that means that they are at risk of going on to develop type 2 diabetes if they haven't already. Family history is very, very strong with type 2 diabetes. So what I mean by immediate family is siblings and parents. So you see families who are very, very familiar with type 2 diabetes because they have so many relatives living with it. It's one of those things that your chances of developing diabetes go up with age, but it does depend on your ethnic origin, on how old you are likely to be prior to developing type 2 diabetes. So people of white ethnicity, usually over 40, although it is seen in children and teenagers now. But if you come from other global heritage, particularly South Asian or black backgrounds, you are more likely to develop it at an earlier age, from 25 onwards. If you already have high blood pressure or existing cardiovascular disease, you are more likely to go on to develop type 2 diabetes. And so many of the risk factors and the lifestyle factors that contribute to high blood pressure and cardiovascular disease are the same. There's no great surprise that there is a link there. Women living with polycystic ovary syndrome are highly likely to go on to develop type 2 diabetes, and we will talk about PCOS in a later session. And if you have gestational diabetes, i.e. you have diabetes when you are pregnant, you are much more likely to go on to develop type 2 diabetes, although the gestational diabetes stops usually when the baby is born. So it's kind of almost like an instant cure is childbirth to gestational diabetes. But if people don't manage their weight, they are highly likely to go on to develop type 2 diabetes. We know that there is a link with high intakes of sugar-sweetened beverages, and we also know that some mental health conditions mean that people are more likely to go on to develop type 2 diabetes. So people living with bipolar, depression or schizophrenia are at particular risk. Sedentary lifestyle, another reason to be active is you will decrease your risk if you're active. High alcohol consumption, smoking, again, increase risk. Poor sleep increases risk. So some people have chronic sleep problems, much more likely to go on to develop type 2 diabetes. And there's also a link with poor sleep and obesity. And it's slightly more common in men. So that biological sex makes a difference. So what are we looking for as far as possible signs and symptoms? Now, not all of these symptoms will be present in everyone. In fact, some people will have diabetes and have no symptoms, or have type 2 diabetes and no symptoms. So firstly, the most common one really is polyuria. Poly meaning lots, urea relating to urine. So basically weeing a lot, particularly in the night, nocturia in the night. So people will be passing a lot of urine, and they will be doing it more frequently. So people will often feel tired because of poor sleep. Polydipsia, the dipsia refers to thirst. So people are excessively thirsty. And of course, what a lot of people will do when they feel thirsty is drink fizzy drinks, sugar-sweetened beverages, which of course pushes their blood sugars up higher, and therefore they are more and more thirsty, and therefore they wee more and more, so that it becomes a bit of a vicious circle. People will feel very tired, and that makes complete sense because the glucose is not getting into the cells where it should, and it's in the blood, which isn't providing energy. And of course, a lot of the glucose will go out in the urine, and therefore it is lost. Some people will lose weight. That's more common in type 1. Blurred vision may happen. Because of the extra sugar in the urine or glucose in the urine, people are much more likely to get conditions like thrush or genital itching. Cuts and wounds don't heal as well, again because of the high blood glucose levels, and people are more likely to get infections. Urinary tract infections are extremely common. People may well feel hungry. That's because the sugar is not getting into their muscles. And you can also sometimes find a condition, a skin condition, which is causing dark pigmentation in places like armpits and skin folds in the groin and in the neck, and that is acanthosis nigricans. So not everyone's going to have all of those symptoms. Some people will have diabetes for quite a while before these symptoms develop, and generally speaking it will develop over years. Symptoms are not as profound and pronounced as type 1. So we're trying to encourage people to do things to change their lifestyle to decrease their risk, and to be mindful of the signs and symptoms really. So how do we diagnose it? HbA1c is the most common measure that will be done, and this gives an idea of how the blood sugar levels have been over the last 3 months. So under 48 is not diabetes, but if it's 48 millimoles per mole or more, then that is indicative of diabetes, particularly in the presence of symptoms. You can do a random venous plasma glucose if that's more than 11.1 millimoles per mole, or if you've got a fasting plasma glucose over 7 millimoles per mole. Those are in the presence of symptoms. If you get an abnormal HbA1c and there are no symptoms, then it should be checked to be sure that that's actually what is happening. It's different for children, so the diagnostic criteria are different for children, so I'm just focusing on adults here. So when is HbA1c not appropriate? There's just a list of things here really. It's children and young people. Anyone that you expect has type 1, because type 1 is acute, it comes on quite quickly. HbA1c is not going to tell you the answer. If people have had symptoms less than 2 months, it probably isn't going to, because you need 3 months for it to be valid, it probably isn't going to give you the answer. If people are acutely ill, then blood sugars tend to go up when people are ill, so that might not be the best way to look at it. There are medications that cause rapid glucose rise, like steroids and antipsychotics. Other things that might be causing pancreatic damage, for example, including surgery. And you don't do it in pregnancy. I'll come back to what you do later. And if there are other illnesses that might be impacting on HbA1c. Pre-diabetes you will hear much more about now, and this is that situation where blood sugars are higher than usual but not high enough to be diagnosed with type 2 diabetes. So we're looking at a group of the population at high risk, it's that 13.6 million, of going on to develop type 2 diabetes, but usually no symptoms. And this is, if you remember that diabetes is 48 millimoles per mole, pre-diabetes is 42 to 47. And at this stage, up to 50% of these cases can be prevented if people can lose weight, eat a healthy, balanced diet, and be more active. I just wanted to kind of give you an idea that there are a number of charts out there that help you to convert HbA1c to percentage, millimoles per moles or percentage. Clearly doesn't show up on the slide, but the link is there if you wish to have a look at that. Even small improvements in HbA1c. So there was a UK prospective diabetes study demonstrated improving HbA1c by 1% decreases the risk of the complications of diabetes. So it's worth trying to get HbA1c down even if you don't get it back into the healthy range. So from the point of view of the risk of complications with eyes and kidneys, nerve damage, it can, that 1% change decreases that risk by 25%. So there's a lot of benefits to managing HbA1c and bringing it down into those healthier ranges. And briefly, just to tell you a little bit about gestational diabetes and diagnosing that, it can be diagnosed at any time during pregnancy, but it's a different mechanism. We're looking at fasting plasma glucose of more than or equal to 5.6. So that's kind of first thing in the morning when the mother hasn't eaten any food since the night before. Or more often they do this, and this used to be routinely done for other people as well, but it's not now. But the oral glucose tolerance test, which I've done a few of over my time, basically you have to take a dose of Lucozade, which relates to a prescribed amount of glucose, and you follow to see how long it takes the body to clear that glucose to get it back to the normal level. That's just some of the basics of diabetes, so that you come with an understanding, and we can focus in the session a little bit more on how to look after diabetes through diet and exercise and medication. And what I'd like you to do is have a look at this exercise, think about how you would explain type 2 diabetes using plain English, and we will spend a bit of time looking at this at the beginning of our session. So please just spend a bit of time trying to write down how you would explain this and how you would make it clear and easy for a service user to understand.